People say that when you die, you see your whole movie of your life in front of you. I actually saw the movie of my life after they gave me the news. My name is Ghecemy Lopez. I am 39 years old. I was at home and watching TV and I felt a lump. My husband said, well, you should get a check. I was diagnosed with triple negative breast cancer when I had just turned 30 years old. People say that when you die, you see your whole movie of your life in front of you. I actually saw the movie of my life in those seconds after they gave me the news. Because of how dangerous that triple negative is, the doctor wanted to make sure that I had better chances of not having a recurrence. So she decided that I had to do chemo prevention. During the time of my chemotherapies, I had to undergo genetic counseling and genetic testing. And I tested positive for the BRCA1 mutation. The counselor told me, you have to ask, if there was any cancer in the family, what type. Every family member I asked on both sides of the family told me, no, there is no cancer. So one of my cousins called back after, and she said that she didn't want her mom to hear, but she had been a survivor of kidney cancer. It's a lot of lack of information and misinformation around because they don't want to confront the cultural taboos around cancer. I am currently in no evidence of disease. That means at the moment there is no test that can prove that I have cancer floating inside me. But I'm also mindful that that doesn't mean that it's not somewhere there. That's why I'm very excited about participating in cancer research, because we can at least find more answers. I remember the moment that I decided that I wanted to do something more than just being a cancer patient. I was feeling really down, and my genetic counselor came to visit. And she said, no, not only I need you, but many people in the community need you, because there is a high need for people who can be helping others who cannot speak at the moment. And I see that you have that potential. At USC, I joined the Norris Cancer Survivorship Advisory Council, and then I started joining other hospital boards and attending conferences.
Cancer is a roller coaster. It has ups and downs and curves, but mostly importantly, it's temporary.
I am so grateful of all these tables that were with a seat available for me, so I could represent the voice of other, not only Spanish-speaking patients, but underserved communities that may not have the opportunity to be educated, literate, or linguistically or culturally trained to understand what is out there for them. We want to continue funding research because we deserve to live longer. We are trying to make an impact for everybody in our community. And we want to make sure that our voices and the voices of all the people who have passed are still present. It's for my patients. It's for the generation that comes after, because we don't want to have to live through all these toxicities for the rest of our lives. If we can improve research and we can improve the treatments, I believe it's possible. I think we have really amazing, talented people around. And I think it's important that our elected officials that represent us, that we have all our hopes in their vote, that they think of us.